The skill I'm going to show you in this video has totally transformed how I suture at the back of the mouth. So I no longer do instrument ties at the back of the mouth. I shouldn't say I no longer do it, but I primarily do hand tying. Now hand tying is something that to me looked like magic the first time I saw it. It was an oral surgeon and he was doing all these things with his fingers and whipping the suture around, and somehow like the sutures were going in and they were staying tied, and it was happening really, really quickly, faster than I could make sense of. I had to look into it more, and what I found out was this wasn't some kind of magic that this guy created. This is actually something that's done commonly in the operating rooms, and surgeons use it all the time. And you'll be able to tell why when you see how expedient this is and how efficient you can be. Now, the part that I liked about it was that I wasn't fumbling around at the back of the mouth with the needle driver. I found it way easier to kind of go through these motions that I'm about to show you, and then your fingers just kind of slip in naturally almost to the back of the mouth. It was almost second nature once I got going. And yeah, it takes lots of practice. Grab something like I got here. You can basically tie this to anything. You can tie it to a coffee mug. I've got a little carabiner thing here attached to a thing that my kids use for counting. So it's whatever you can find, basically, and then just a string. And just do this over and over at home. It'll probably take you a couple nights, 2 or 3 nights, just sitting there doing this over and over, tying knots, and you'll be really comfortable with this. So this technique is called a one-handed tie. Now, this was named by a doctor, obviously not a dentist, because you use 2 hands, right? But it's a one-handed tie. It's very confusing. I think what they're saying is one hand does all the work, right? Mainly all the work. So that's why it's referred to as that. There is a 2-handed tie technique where you actually use both hands to do things. It's, again, to me a little bit more confusing, more involved, and it's something I haven't really focused on a lot myself. I thought if there's 2 techniques, one is faster, more efficient, you might as well just learn that one, and that's what I'm going to show you in this video. So it's the one-handed tie. Now let's get into it. So to hand tie your sutures, what you're going to do is you're going to lay the suture out on your hands like this. Now let's say that I'm right-handed and I've got my needle end over here. So we're going to have this one be kind of somewhat stationary. This left hand is going to do all the work in the video. So that's going to be our one-handed technique that I'll show you in a sec. What you want to do is you want to hold these like the reins of a horse. So drape them over your hands, pinch it together with your thumb and your index finger. These guys aren't really involved at this stage. So you're just holding it here like this. Now, get a little bit of tension on things just to snug it up a bit. And what you're going to do is you're going to use your left hand now to do the first motion. Now, the first motion can be described several ways. The one that made the most sense to me was the karate chop. So the karate chop is like this. You take these 3 fingers and you chop the suture. Now, you don't have to be so aggressive. You can just kind of loop the suture over top of there. So you can see where we're at now. I'll pause for a second. We've got our index finger still holding it like we originally were with our thumb. And now we've got these 3 fingers kind of chopped over top of the suture. This right side is still kind of held snugly. So I'll back up and we'll do this again. So we're right here. We're going to come over and we're going to bring this down. So now our hand is kind of laying flat. And it's just laying there ready for something to sit against it. And the best thing to put against it would be this side. So we just put this right over top. So now that's the second step. Okay, so we'll go back again. I'll go through this very slowly because again, it's kind of confusing when you haven't done it before. So holding the reins, we chop the suture, and then we bring this side over. So the next step, this is the crucial part. So now this relies a lot on your middle finger. Now your parents always said don't use your middle finger. They probably wanted you to keep it preserved because they knew you were going to be a dentist someday and this was going to make you a good living. So no, I'm just teasing. But in this case, you want to use your middle finger. So that's going to be the key here. So what you're going to do is you're going to take this side that's over here and you're going to use your middle finger to pull it. Now we're actually going to pull it in behind. If you can see that, right? So we're pulling it behind the one in the left hand, and now the middle finger is going to come the other way, and we're going to pull this away from our thumb and our index finger. See where it is? Now it's grasped between these 2 guys, and now we loop this back, and now you'll see what happened. We just made a bit of a tie there. You can pull out with these fingers, and simultaneously your index finger can be used to slide your knot down. and tighten it up. Okay, so let's go through that again. So I'll go through those motions. I'll do it a little bit slower, same idea, but we'll do it all together. So we're going to have holding the reins, we're going to chop the suture, bring it over, middle finger crosses underneath, pulls that out, and slides it through, out to the side, and then we go all the way down. Okay, so that's the first step. All right, cowboy or cowgirl, we're going to get back on the horse. So that's what we do after our first throw. We grab our reins again, and we're going to get back to home base, our starting position. This is our free end. This is our needle end over here. What we're going to do is we're going to slide our thumb on the left hand down a little bit, just to create a little bit of separation between the index finger and the thumb. And the reason that we do that is we're going to bring this right side underneath. So we want to have a little bit of space to bring it into. So could you be a little bit closer together? Certainly. You just have to get it under that index finger. Okay, so we're going to do that. So we're going to pull this over, and now this index finger does all the work. So let's just see where we're at. You see how I'm kind of sandwiched between? A little different angle. We're going to bring it how we were there, and now we're going to bring this index finger under and around. So the goal here is to loop this on the index finger, and we're actually going to grab on with our middle finger as well. So that allows us then to pull that string of the free end through the loop. And then as we pull down and away, we can use our middle finger to, again, snug that down. So never hesitate to use that middle finger, just when you're suturing. So that's it. So that basically completes our square knot. Now that's pretty cool, right? Now you can go back and you can throw a couple more square knots. Now the way that you do that, same thing. We're going to karate chop over the top, come around, and now we look which way the free end is pointing. So it's pointing right now kind of away from us. That's the way that we're going to pull. So we're going to pull over there, and then we're going to come back here, again, the home base, reins of the horse. We're going to do what I just showed you. So you bring this under, loop your index finger around, bring it out, and now you can see it's wanting to come towards us, that free end. So we're going to pull this way. And now we've just stacked another square knot on top. So you can do that over and over and over when you practice, but basically it allows you to tie a secure knot, and when you put those two motions together, it allows you, again, to be very efficient. So you can throw in a lot of sutures in a minimal amount of time. I would really recommend that you get a hang of it and just give it a shot.